Welcome to Understanding Human Anatomy. This is a continuation of our discussion of the pelvic cavity, and in particular we're discussing the pelvis. In this video, what I'd like to do is discuss the differences between the male and the female pelvis. Now, the differences that we're going to talk about are differences that make it easier for the female pelvis to carry the pregnancy, and most of all, to facilitate delivery by providing a minimum of obstacles to the movement of the baby through the pelvic canal during delivery. Now, these two diagrams you see on the screen, on the left is a diagram of the female pelvis, on the right is a diagram of the male pelvis. And I will tell you quite honestly that I've exaggerated some of the differences between the two pelvises to make it easier to see the differences that I'm talking about. Now, one of the first things that you'll notice in the female pelvis are the iliac wings. The iliac wings are flat, or flatter. So, flatter or more horizontal. And the male pelvis, the iliac wings are vertical. The female wings, by being flatter, make it easier to support the pregnancy, support the uterus carrying the fetus, so that some of that weight is actually borne by the iliac wings. Now, one characteristic that most people look at first when they're trying to identify a male from a female pelvis is the subpubic angle. In the female, the subpubic angle is 90 degrees. It's a right angle. And that angle can be approximated by holding your hand up, and the angle between your index finger and thumb, when your thumb is fully stretched out, is about the subpubic angle of a female pelvis. On the other hand, the subpubic angle on a male pelvis is less than 90 degrees. And angles that are less than 90 degrees are called acute angles. So we have an acute subpubic angle in the male. And if you want to approximate the subpubic angle in a male pelvis, if you take and stretch out as far as you can your index and middle finger from each other, the angle between these two fingers is about the subpubic angle of a male pelvis. Now, one way to facilitate delivery is to shorten the length of the pelvic canal. So if we look at the distance between the pelvic rim and the ischial tuberosity, that's the length of the pelvic canal. And in a female, this is a shorter distance. A shorter distance from pelvic brim to the ischial tuberosity. In the male, that distance is longer. So again, this distance is longer. So that the pelvic canal is longer in the male than in the female. There are other differences. For example, the sacrum is less curved, or it's flatter in the female. Whereas in the male, the sacrum is more curved. Now, what that means is that in the female, the sacrum doesn't protrude into the pelvic canal as much, so it provides less of an obstruction to the passage of the baby during delivery. In the female, the ischial spines are more in line with the pelvic canal. Whereas in the male, the ischial spines project into the pelvic canal. And again, this is a way to open up the female pelvic canal to have less obstruction projecting into the canal, to allow the baby to pass through more easily. Now, the other thing is the size of the opening of the pelvic canal. In the female, if you measure distances across the pelvic rim, or pelvic inlet, they are longer. If you measure the same distances across the pelvic rim or pelvic inlet, they are shorter in the male. And this, again, provides a wider pelvic canal so that the baby can more easily pass through the canal. The male does not have to pass a baby through the pelvic canal, so it can be both longer and more narrow. Now, when you try and tell the difference between a male and female pelvis, you really should look at several characteristics, because any one characteristic can be out of because any one characteristic may be abnormal. You may have a male type ischial spine, for example, projecting into the pelvic canal in a otherwise female looking pelvis. So what you need to do is look at several of these characteristics, and if most of them are of the female variety, then you would call it a female pelvis. If more of them are the male variety, you'd call it a male pelvis. So, these are the differences between the male and female pelvises. And again, the differences in the female compared to the male are all differences that promote the carrying of a pregnancy and facilitate labor and delivery. Thank you for your attention.